My name's Kwaku. I'm currently a CT1 working in London in surgery, and this is my video on how you can best prepare for your upcoming CST interview. First and foremost, congratulations on getting an interview and all the best in your preparation. The format for the upcoming interview is split into two stations. You've got your management and your clinical station, and then you've got your portfolio station. So your clinical station will typically be two clinical scenarios, which may be a CCRISP post-op patient scenario or a ATLS, and then you're going to have a management scenario as well, which is typically an ethical scenario, which requires you to think on your feet. And then the second part of the second station is going to be a scenario based on your portfolio. So they'll ask you different domains of your portfolio, your motivation for surgery, and then also thinking about your speech as well. So typically your leadership speech, which you prepare before the interview. Preparing for the CSE interview can be quite daunting. It's quite difficult to think about the wide array of topics you have to think about and revise for. And so it could be quite difficult to structure your interview prep and thinking about the depth that you need to go into. And that's why the Medibuddy resource is really good, and that's something that I used heavily when it came to my interviews. It breaks down so your ATEs, for example, in your clinical scenario, into bite-sizable, digestible content, which you can communicate across to your examiner, and then will include sort of common scenarios or common questions which will be sort of asked around the topic. In terms of preparing for your interviews, particularly your clinical scenario, what's really important is that you try to include as much as you can in a succinct manner in your ATE, so that you're probed as little by the examiner when it comes to your follow-up question. The Medibuddy resource is really good for me because it enabled me to track my progress with a friend. So what's really good for your interview preparation is if you have your Medibuddy account, you can more or less tick off all the different scenarios for your management and your clinical scenarios. And when you're practicing with your friends and your revision groups, ensuring that you're marking yourself against the marking criteria and knowing what the gaps in your knowledge are. And then when you do repeat the station going forward, knowing what you need to be doing to score in the top. So for me, Medibuddy really enabled me to sort of track my progress, making sure that if I did have gaps in my knowledge, identifying them and then working on them. Also, when it came to my management scenarios, there can be quite a wide array of sort of scenarios that you can be given. But what the Medibuddy resource gave me was a clear framework that I could apply to different scenarios, particularly in the management cases as well. So thinking about what I need to be doing to ensuring that I'm being a safe doctor, but also ensuring that I'm advocating for patients and my colleagues if that was what the scenario demanded for me to do.